Hi everyone, my name is Stephanie, and today I'm going to speak to you about death with dignity. Almost 9 years ago, I made the decision to pursue a career in healthcare, and today it is my second home. I formed important relationships with fellow coworkers, doctors, and volunteers, but most importantly of all, the sick and dying individuals that I provided care for, lent a shoulder to lean on, and stayed by their side as they took their last breath. I have witnessed the suffering who have incurable illnesses, and I have listened as they have pleaded for death to bring them to the other side. Even though death has become a norm in my profession, I still ask the question, who is in charge of our lives, and shouldn't we have the right to control our own deaths? Death with dignity, which is also known as physician aid in dying, has always been an extremely controversial subject, which has created a great debate between its supporters and critics within American society. But why not have something available that is going to allow for respect of patient liberty, provide relief in suffering, all while ensuring a safe medical practice? As it is stated on deathwithdignity.org, Death with Dignity allows certain eligible individuals to legally request and obtain medications to end their life in a peaceful, humane, and dignified manner. Oregon became the first state to pass the Death with Dignity statute, naming it the Oregon Death with Dignity Act. Many states followed in Oregon's footsteps, including California, Colorado, District of Columbia, Hawaii, Vermont, Washington, and most recently in 2019, the state of Maine. The Death with Dignity law allows for patient liberty, which means that person has governance over their own actions, such as determining medical interventions. If we are permitted to make our own healthcare decisions throughout life, then why can't we have control over our own death? Even though controversy surrounds the Death with Dignity law, there is a long history of support from Americans. According to a Gallup poll, which was taken in 2015, nearly 7 in 10 Americans, which is about 68%, agreed that physicians should be allowed to assist terminally ill patients in ending their lives. This level of support has remained steady since the question was first introduced in 1977. Dr. Michelle Abadur, who suffers from stage 4 metastasized breast cancer and resides in New York, shares her story on deathwithdignity.org. And she says, if you know that you may have an illness that will leave you debilitated and you don't want to have to suffer, or put the burden of your physical decline on your loved ones, you should have the decision-making power to utilize an assisted dying law. One of the main reasons the majority of patients request the lethal prescription is because of their loss of autonomy, dignity, and the inability to enjoy life. It is argued that physician aid in dying, or death with dignity, isn't necessary because it's inhumane and our healthcare system already has a solution in place for the dying, which is hospice care. Hospice care is available for individuals who have been determined to have 6 months or less to live and need assistance with daily activities, and it also offers support physically, emotionally, and spiritually. I have seen firsthand how amazing hospice is and how it truly benefits the terminally ill, but it doesn't always completely take away the suffering. There are some diagnoses that prove to be fatal, but most concerning guarantee a death of suffering and misery, even with the help of hospice. Arthur Rifkin, a professor of psychiatry at the Albert Einstein College of Medicine, stated, while many terminally ill patients can indefinitely relieve their suffering through the use of effective pain management techniques, there are some patients whose pain cannot be eased. Rather than endure great pain and suffering for the remainder of their life, these patients should have the ethical choice to end their lives. Despite justified concern over the potential abuse of euthanasia and assisted suicide, competent patients who are suffering should not be denied the option of assisted death. As some say, aid in dying is inhumane and causes concern for abuse. But wouldn't you consider it inhumane to make a suffering person who knows they are going to die live longer than he or she wishes? Lastly, many believe physician aid in dying isn't a safe medical practice, when in fact there are many safeguards in place to prevent abuse of the law. Safeguards that were listed on verywellhealth.com include the patient being informed of all end-of-life options. The patient must be capable of making healthcare decisions for themselves, which is determined by the prescribing and consulting physician. The patient has to make 2 verbal requests to their prescribing physician, separated by a minimum of 15 days. The patient makes a written request, and it is signed in the presence of 2 witnesses. Today, there may only be 8 states that have passed the Death with Dignity law, but there is hope that in the near future, the rest of the country will follow in the same footsteps. Death is a natural part of life's journey, and if we have the ability to control our deaths, especially in a time of suffering, we should have that option, because a death with dignity is our ultimate civil right. Thank you.